at Fox Chase, we celebrate our patients and our staff.
The nursing staff really values how well they treat the patients. It's important to all of us. We will do anything that we can to make sure that they're comfortable and safe and fearless.
There's a really strong bond and trust within the physicians, the nurses, our front desk staff, our medical assistants.
They really, really support you. It all boils down to, I think, Fox Chase's understanding of what quality nursing is.
I wanted to show compassion. I have it, I just needed to show it. And no better way to show it than to be at a hospital that shows it.
They're different people once they leave Fox Chase, and I'm grateful to be part of all of that change, all of that progress, because it fulfills me as an individual.
I'm the charge nurse of the Peri-Op area. If they are a same-day surgery patient or if they're an in-house patient, we get them completely ready so that they're ready for surgery. So at 18, I wasn't sure what I wanted to do after high school. So my boyfriend at the time had said to me, why don't you go to school for hair? So I opened my own salon. We ended up getting married. Time went on, we ended up getting pregnant with my son. And then my husband got sick. He ended up having pancreatic cancer. We went through all the treatment, went through everything that we could do, surgery, everything. But eventually he succumbed to the pancreatic cancer and I lost him. I couldn't get past why nobody could help us. So I thought if I went to school just to learn about cancer, I would feel better, I would understand it, and I would eventually be okay. I came here to Fox Chase. This is where I actually learned. I can show my skills and do what I need to do for other patients. I wanted to show compassion. I have it, I just needed to show it. And no better way to show it than to be at a hospital that shows it. He would be impressed, he'd be very happy. He's the whole reason I'm doing this.
After nursing school, I transitioned into the nurse residency program. And I had my preceptor, Krista, who basically took me under her wing and held my hand through the whole residency program. They really, really support you. It all boils down to, I think, Fox Chase's understanding of what quality nursing is and what, I think Fox Chase stands for nursing excellence. And I think it's important that new nurses have preceptors who are willing and able to show them what compassionate nursing looks like. My unit has a lot of private rooms, and so most of the time, my patients are transitioning to hospice. For me, it's about going home and thinking, oh my gosh, I'm really exhausted, but somebody smiled. Somebody was able to say, oh my gosh, I had such a long day, and thank you, I slept really well. So that's what makes me fulfilled.
I am extremely proud to be a Fox Chase nurse. There's a really strong bond and trust within the physicians, the nurses, our front desk staff, our medical assistants. I work primarily with one of the surgeons, and then I also run one of the intravesical bladder treatment clinics. The support from the physicians when the nurses have an idea is outstanding. We are very autonomous in the care that we give. They're there with open arms saying, yeah, let's run with this. Let's see how we can make this treatment better for these patients. So I had an idea for my 8 bladder intravesical treatment patients. I brought it to Dr. Kutukov's attention and he said, run with it. When my patients come for their intravesical treatments, they're always a little bit anxious. So I play reggae music. It makes them feel like some island music, kind of calms them down a little bit. Nobody's sad looking at a palm tree, so. One of the things I say about Fox Chase is that when you come here, they treat you like family. Everyone's going to put you first.
I got into nursing because I used to work at a dental office. I started going to nursing school, and I feel like in nursing school was where it was like an ignition of that passion. At the time, really, Fox Chase was the only hospital that was offering, it was like a 6-month-long graduate nursing program. To have those 6 months here, you just received a full-rounded experience in your nursing, and I feel like that gives you the ability to know from that point where you think you want to grow. My favorite part is actually my patient interaction. So now, as a radiation staff nurse, we do a lot of educating, what the side effects of radiation are going to be, what to expect during their radiation treatment. They choose to be with us, and I want to make that experience for them the most comfortable, peaceful experience that I can. The patients are our number one priority, but I think that the way that the staff supports each other, encourages one another, the team that I work with has done an amazing job supporting me through a lot of the personal things that I've had to endure over the last few years. Here at Fox Chase, we celebrate our patients and our staff.
It says a lot that I've been here 35 years and I still enjoy coming into work. So when I came here as a nursing student, the staff that I was working with were just so welcoming and so knowledgeable. Then I knew immediately that this was where I wanted to be. So right now I work in the clinical research unit where we are giving chemotherapy and study drugs. It's just so rewarding. We have a lot of teaching that goes on in our unit. We have a lot of master prepare nurses that we can refer to and say, hey, I'm having an issue with this, or can you explain how this is? And they're more than willing to help. The magnet is an award, and there's many components to it, whether it's collaboration or administration or different things like that. We work together as one big unit and one big facility to make sure that the nursing is as excellent as it can be. So we're a smaller hospital, but patients know we're bigger in heart. The nursing staff really values how well they treat the patients. It's important to all of us. We will do anything that we can to make sure that they're comfortable and safe and fearless.
I work in the ICU. I'm a CNA there. And what we do there is we recover surgical patients that are a little unstable or too unstable to go out into the surgical step-down unit. This is a lot different from a regular hospital, and we are now entrusted with the care of these individuals who are in their weakest, most vulnerable moments in their lives. When I first came here, being that I've never worked in a hospital, they were very accommodating for me. They gave me a preceptor that helped me along the way, explain the way we care for our population here. I am a bold person. Whenever I find myself wanting to do something different, something new, I tend to read up on it and just go for it. I hold myself accountable for the work, I hold the patient accountable, and together, there's nothing we can't accomplish. They're different people once they leave Fox Chase, and I'm grateful to be part of all of that change, all of that progress, because it fulfills me as an individual. And I always say, you know, when you're being discharged, I'm gonna be the one that's gonna walk you to that door. We're gonna do it together. I can't see myself doing anything else.